Welcome to the deep dive. Today, we're getting into something huge, the global wellness industry. I mean, it's massive, right? A $6.3 trillion enterprise. It makes these really big promises, empowerment, natural health, a whole alternative to maybe traditional medicine. But the real question we want to ask for you is, well, are these promises actually healthy? Or is there maybe a darker side where profit matters more than your well-being?
Yeah, and to really unpack this, we're looking at a fantastic article by Professor Lin that's called A Dangerous Marriage, Wellness Culture, and Political Power.
Yeah.
It really digs into how this industry works, how it connects with certain political agendas, and honestly, the risks this creates. So our mission today is to understand an operation, its impact sometimes surprising on public and animal health, and why critical thinking is just so vital now.
Okay, so let's start there. Professor Lin says the main focus isn't health, it's profit. How do they manage that, especially if it's potentially at the expense of health?
Well, what's really interesting and what the article lays out is how the industry sort of leverages public distrust. Distrust of government agencies, mainstream medicine. It's not just about selling you a supplement that might not work. It goes deeper. It's about actively undermining science-backed health policies. And you see this connecting to bigger things like anti-vax movements, even COVID denialism. It creates a real problem for public health officials.
Right, not just theory. And Professor Lin uses the H5N1 avian flu crisis, which is happening now, as a very clear example of this, doesn't she?
Absolutely. It's a perfect storm, almost. You have public health experts saying, okay, we need science, we need containment, we need oversight to stop this thing spreading. But then you have some voices in the wellness sphere pushing for less oversight, advocating for, natural approaches. It directly ignores the real threat the virus poses. It's a stark case of how these anti-science narratives, sometimes tied to profit, can make us all more vulnerable.
And that connects to political power. The article brings up Robert F. Kennedy Jr. and a specific move concerning the FDA's Center for Veterinary Medicine, the CVM. Why is the CVM so important here?
Okay, so the CVM, thinking bigger picture, is really your first line of defense. It's critical. It's the main body working to stop viruses like H5N1 jumping from animals to people. They oversee pet food safety, track zoonotic diseases. That's just the animal-to-human stuff. So the attempt Professor Lin highlights to basically get the CVM, that represents a huge shift away from science towards maybe ideology-driven policy. It's risky.
Okay, that makes sense. So how does the industry actually make money from pseudoscience? You mentioned manufacturing fear.
Yeah, it's often about creating anxiety, fear about toxins everywhere, or demonizing big pharma. And once that fear is there, they conveniently offer the solution. Expensive, natural alternatives.
Like raw pet food, maybe? Or homeopathy, things people might actually encounter.
Exactly those kinds of things. Products that often have zero proven benefit, and sometimes, like with raw pet food, can carry real risks like salmonella or listeria. But they're marketed as pure, as safe alternatives. It's a cycle. Create fear, sell the fix, and it's incredibly profitable.
Right. So pulling this all together, what's the takeaway for you listening? This deep dive seems to show a pattern, doesn't it? When you have distrust in science, maybe fueled by charismatic figures, and then industries exploit that distrust for profit, it can lead to real harm, preventable suffering.
That's precisely it. We've seen it before, haven't we? With vaccine misinformation, with aspects of the COVID response. And now, Professor Lin argues, it's threatening our defenses against diseases that jump from animals. Science, solid evidence, sensible regulation. These aren't just nice to haves. They're fundamental. They are the bedrock of public safety. We all need to be, vigilant, really question where our health information comes from, and demand that health policies are based on evidence, not ideology or profit.
So we'll leave you with this thought. In a world just overflowing with information, quick fixes, wellness promises, how will you empower yourself? How will you really tell the difference between what genuinely supports your well-being and what's just, profitable for someone else?